Hey, Central Virginia, Dr. Keith Lynch here. I've been in private practice since 1998, and since then we've been doing all our adjustments without any twisting, popping, or cracking. So I'm here to describe and demonstrate that for you today so that you know exactly what I mean. Now, this here is my chiropractic adjusting instrument. It looks like a jackhammer, sounds like a woodpecker. The way this works is this instrument can be used very hard or very light, and I can make my corrections along the spine with it, and we can set the vertebra back to their proper position. We can also set extremities and cranial bones. We can adjust the TMJ with this instrument, and it's very light and it's very gentle. Most of my patients, when they receive an adjustment with it, say it actually feels really good. So what I'm going to do right now is I'm going to demonstrate that for you. So I'm going to show you that demonstration right now, and we're going to do this standing, although frequently in the office the patient's seated, but we can put you in whatever position we need to make this correction. Turn your head all the way to the right, please. Thank you. So we can adjust those bones and bump that hard bone off of that soft nerve with this instrument. We can also reinforce that cervical curvature to get that curve back in the neck if you've been in a whiplash type injury. And then if there's any rotation, we can turn the head and take the rotation out using this instrument. The other thing that we can do is we can also correct disc misalignments. So if you've been diagnosed with a bulging disc or a slip disc based on an MRI, we can also help you with that. As a matter of fact, we enjoy doing it because when that disc is out of position, let's say for example it's C5, that goes to your axillary nerve which controls the deltoid. So during our examination, we'll actually find that area to be weaker than the others. And then when we come in for treatment, we'll be able to not only make that correction, but we'll be able to retest it afterwards, and you'll be able to see a 30 to 50% increase in strength immediately after the treatment. And I love that because it gives me the confidence to tell my patients, hey, that's going to get better. And that's part of what we really enjoy doing here. Now, another tool that we use in our office is cold laser. And we use the cold laser because they've done studies on how nerves work and how nerves heal. And out at the University of Colorado, they put the weight of a dime on a spinal nerve, and they measured how well it worked. And it took 97 days until that spinal nerve transmission was back up to where it was before they compressed it. So by using cold laser, what you'll see is just a pulsing red light. That's why they call it a cold laser, because there's no thermal effect or cutting that happens. So by applying that over the nerve root, it actually increases the mitochondria's ability to heal, and that's what speeds up the healing so much. So what we see in the office is patients come in, and if they have a nerve that's been damaged or injured, what's going to happen is the muscles that goes to are going to be weaker. And when we apply this over those nerves and we test those muscles and then retest them immediately after during that same visit, we see improved strength. There have been hundreds of studies on cold laser where they've seen carpal tunnel improve, they see soft tissue improve, we see microcirculation improved. And it's just an awesome tool, and we love using it because our patients get absolutely great results with it. Another tool that we use in practice is the percussion instrument. So this is the percussion instrument right here. You can kind of hear it there. And it's actually a hammer. But the way that it works is if I slow it down, you can actually see that the head of it goes up and down about 1/4 of an inch. But we're going to speed it up so much that you're barely going to see that, you're barely going to feel that. It actually feels really good when we use it. And the reason that we use it is because the covering of your muscles has something called fascia on it. Now, fascia is a glycoprotein or a sugar protein. Over time, when muscles have been out of balance, those sugar proteins have a tendency to break down and stick together or adhere. Those adhesions are what create scar tissue, which limits range of motion, and it slows down your healing. So getting on the places where those nerves get entrapped with an instrument like this is incredible, because you can actually get right in there and release those adhesions, and you can see the range of motion just come right back up, and the healing just really takes place after you use an instrument like this, getting those nerves working better again. Another tool that we use here in the office is called the Rapid Release 2 instrument, and this, similar to the percussion instrument, is an instrument that actually moves, and it's kind of loud. I'm going to put it on real briefly. And the way that it moves and oscillates, it moves these three individual heads that you can put either on a muscular area or a hard bony area or a big flat area, and you can really release scar tissue adhesions with this. The speed at which this moves is even faster and more powerful than the previous instrument, the percussion instrument I showed you. So with all these different tools, we've got ways of getting the soft tissue to heal, we've got ways to get the alignment back in the spine, and to help those nerves heal faster. They're just great tools that we have, and once again, we're able to accomplish all of these things without any twisting, popping, or cracking. I've been board certified in Atlas Orthogonal Chiropractic since 2000. What we're going to talk about is our structural adjusting program for the Atlas area. Now, the Atlas, or C1 as it's known, sits right underneath the skull. It's the very top vertebra of the spine. And that Atlas vertebra weighs about 1 to 2 ounces, and your head or skull above that bone weighs 10 to 12 ounces. In health, that bone sits right around and protects your brain stem, and it also has the vertebral artery, which brings blood supply up from the heart up into the skull through to the brain stem as well as to the cortex. So it's a very important area. When we make our adjustments to that area, we use a specific instrument that makes an adjustment force of about 1.8 pounds. So it's very delicate. And the reason is because this. When that head gets off-centered over the neck, it can put pressure on that atlas and blood vessel area. We call that neurovascular compression. Neurovascular compression means this. It means that the blood vessels can be compromised, reducing the amount of blood flow to the brain stem, which controls digestion, absorption, elimination. It controls our eye function and all the sensory organs inside the head, as well as cognition up into the cortex. So people who have migraine headaches, people who have epilepsy disorders, people with head, neck, and shoulder problems, jaw and facial pain, this area is often implicated as one of the sources causing those problems. So when we have neurovascular compression, it's going to put pressure on the blood vessels going through that area. It can also put direct pressure on the brain stem itself, and then it can also cause the muscles underneath the skull here to be extremely tight, reducing your range of motion and causing further problems both up and down the spine from that area. When the atlas misaligns underneath the skull, what happens is there's a righting reflex in the body that's always going to keep your eyes level with the horizon. So if that vertebra comes up on your left side like this, it's very uncommon to see somebody walking around like this. What you're going to see is a postural distortion where the spine is going to bend or curve, and the eyes are going to become level with the horizon. So what you see is less of the head tilt, and you're going to see more of a postural distortion that gets displayed throughout the entire rest of the body. So one shoulder may become higher than the other, one hip may draw up higher than the other, and it can cause a curvature through the spinal column, allowing that head to be level over the center of the body. So not only can it cause problems or symptoms up in the head and face area, but it's going to cause problems from the neck area down throughout the pelvis, because it's going to cause certain muscles to become over-tightened while other muscles have to relax to allow that spine to curve. That's what we call a postural distortion, and that's one of the things that we're checking for when you have an atlas misalignment. Now, the way that we correct this misalignment is through specific x-rays and analysis of that head and neck area. So after a thorough examination is done on that head, neck, and spinal area, we take 3 specific x-rays to show us the front, the side, and the top, so that we have a 3-dimensional image of that misalignment. After measuring that, we get what we call factors or vectors. It becomes a force direction that we use with our instrument to make the correction. Let's go ahead and take a look at that right now. This is the Atlas Orthogonal adjusting instrument. Most people, when they first see this instrument, they think it looks pretty scary and they go, boy, my neck already hurts, you're not going to touch me with that thing. However, what they find out is the way this instrument works is there's a 1.8 pound solenoid, or a very small electric hammer, which comes down inside of this here. And it strikes the top of this metal piece called the stylus. Now this stylus here, as you'll see, does not go up and down. So if you were to put your finger under it and feel that, you'd probably say what most of my patients say and say, I don't feel hardly anything. And that's good, because it's designed so that you don't feel it. Imagine if you've just been in trauma or in a car accident and you can't move your head and neck around. This instrument's designed so that we can lay you on your side on this table, precisely align you, put the appropriate factors based on your x-rays into the instrument, and then what we do is we deliver that 1.8 pounds of force to that atlas bone, or that top vertebra in your neck. And what's going to happen is that top bone in the neck is going to slide right underneath the skull, just like this. So even though you hardly feel anything, that vertebra is going to slide back to its normal position due to a precision amount of force, just 1.8 pounds, right over that atlas or top of the neck region. By doing that, it immediately takes pressure off that brainstem area. It allows the blood vessels to start delivering the right amount of oxygen and nutrients up to the brain. It allows the spinal column itself to start leveling out, takes pressure off the muscles that were holding you in a postural distortion to begin with, and the self-healing process begins. That's how the Atlas Orthogonal adjustment works, and it's a very effective and efficient tool in helping people get their lives back and get out of pain.